Welcome to the Brain Injury Insider. I'm brain injury attorney Michael Kaplan. Today I'd like to discuss a new study examining treatment options following the development of a traumatic subdural hematoma, a condition where blood collects rapidly on the surface of the brain. This bleeding may cause pressure on the brain and can lead to worsening injury, cognitive deficits, and even death. Falls are a leading cause of traumatic brain injury, particularly among older adults and children. A slip, trip, or misstep can lead to a blow to the head or the sudden deceleration of the brain when it moves inside the skull, causing damage to brain tissue and blood vessels within the brain. In an article published in the JAMA journal entitled Acute Surgery versus Conservative Treatment for the Traumatic Acute Subdural Hematoma, researchers looked at data from 18 level 1 trauma centers across the United States. They focused on over 700 patients who had developed an acute subdural hematoma after head trauma. The big question they considered: do centers that usually operate early have better outcomes than those that tend to a more conservative, non-operative approach? Interestingly, there was a huge variation in how often centers chose acute surgery. Some centers operated on nearly none of their patients. Others operated on up to 86%. But despite these differences, outcomes were similar between centers that preferred surgery and those that preferred conservative treatment, letting the bleeding reabsorb into the brain. In patients without clear indications for surgery because of the extent of bleeding and the extent of pressure on the brain, choosing a non-operative care first may be justifiable and doesn't seem to worsen outcomes. The authors emphasize this doesn't override cases when a patient is deteriorating or life-threatening conditions exist. In those urgent cases, surgery is still essential. But what it does suggest is that for many borderline cases, a more conservative approach may be reasonable. Putting all this together, because falls are a major source of brain injury, and especially for injuries like subdural hematoma, preventing falls reduces injury incidence and a chance to avoid a complex decision between surgery or non-operative care and all the risks that attend each path. For patients and caregivers, knowing that sometimes a non-operative path is evidence-based medicine when a subdural hematoma is diagnosed may help with informed discussions and decision-making. But remember, the best cure for a brain injury is prevention. Thanks for joining me this week on the Brain Injury Insider. If you want to help change the conversation around brain injury, please share this information and consider subscribing. And please join me next week as we continue to uncover the hidden truth about brain injury and its impact on millions of lives.